My name is Dr. Julien Taillade, and I'm a postdoctorate Max Cried group at Monash University, and particularly within the BDI. My field of expertise is more about peptides and every application possible using peptides chemistry. I worked on peptide methodology when I did my PhD in chemistry in Montpellier. I worked in peptide-based drug delivery when I've done my postdoc in Paris. Worked on peptide medicinal chemistry when I worked in Melbourne with Professor John Wade, and joined Max Cried to continue working on peptide antibiotic such as Glycopeptide antibiotic and vancomycin. Basically, the work that we are carrying out in Max Cried group is about antibiotic-resistant bacteria. So the overuse or misuse of antibiotic are creating antibiotic resistance, and we need to anticipate the need of new drugs to palliate this. I'm working on two different aspects. One aspect is trying to find the best way to produce those ones, identify molecules, because they are such complex that only pure chemists can do it after 50-60 steps of pure organic chemistry. It's long, boring, and scaring. So modifying the strain, the bacteria that produce it, is not that easy. It's a bit of a fishing expedition. So we have a project where we're sitting on the edge, using both strengths of the chemistry as well as the strengths of the biochemistry, particularly enzymes. Another aspect of the project is to use a current antibiotic and say, okay, this is already active. Can we modify it somehow to make it better, or to address that specific problem? So that's the beauty of chemistry. We can always play around and modify, test, get feedback, and try to accumulate as much knowledge as we can along the road. So most of the time we have to prepare to use organic chemistry, which means we make an amino acid, a building block, then put it onto the peptide, modify that peptide, express the enzyme on the other side, mix both of them so it forms a specific reaction that are crucial for activity. So range of technique really broad that is covered by my expertise, from the chemistry to the biochemistry perspective. The overview is of my project is always, there is a problem, there is an health issue, and we often work with doctors that always report, oh, this is what is happening, or this is a problem of that thing's drug, this is what is happening. And we as a chemist always try to find a way to modify that drug and make it better, ultimately for the doctor, so they can use something that is working better for them, and also for the patient. Always, sometimes it's good to have a discussion with a doctor, so he can tell you, well, that's the return that I have from those patients that got that drug, they have that problem, that thing, that can you overcome this type of thing, etc., etc. So the long-term goal is not being specific to antibiotics. Long-term goal is to say we have a wide range of methodology skills. We can transfer that to any of these health concerns that can be brought by any potential collaborator or any person within the BDI, Monash University, outside. It's worldwide. Research has no border, only for traveling, where we sometimes need visa, but this is a reality. So my work is mostly based on peptides. I'm the one within the group that usually provides peptides modified or substrate for any type of assay that is happening in the CRI group.